In this presentation, we will discuss steps to solving a medical coding exam case study. But first, I want to introduce you to the team. First up, Mr. Sandeep. Mr. Sandeep coming to you live from Abu Dhabi. He is an AMCI co-lead instructor. Next up, Miss Eva coming to you live from the state of Florida. She is also a co-lead instructor and the intern coordinator. And finally, myself, Mrs. J. I'm the curriculum director at AMCI. Now, let's meet the AMCI interns. We have Miss Anubama, followed by Miss Carla, Miss Courtney, Miss Dolly, Miss Vivian, and Miss Melissa. Goals of the presentation. We will extract the correct codes from pathology and laboratory documentation. Now let's talk about how to solve a multiple choice case study scenario the AMCI way for the board exam. This is how we do it. We teach you to highlight your key terms, and this key on the right tells you the colors that you should use and for what. A yellow highlighter should be used for diagnoses, all diagnoses, signs, and symptoms. The green will be for procedures. So if you have a green highlighter, the green will be used to highlight only procedures. And pink, these are inclusive or bundled items. All right? Once you've done your highlighting, you're going to have to document your inventory. That's your procedures, diagnoses, and select a primary code. Which diagnosis is primary, which procedure is primary. Then you're going to review all pertinent guidelines. And finally, the code that best matches your inventory list is often the correct code, or a code that is pertinent to a guideline. That will be your best code. All right. So here are some do nots. When you're highlighting, you can kind of get discombobulated. So we've compiled some things that you don't even have to highlight. Number one, don't highlight things observed by the physician because you cannot code for them. Number two, don't highlight closures. If a provider or surgeon is closing up a surgical site, there's no need to highlight it. However, if it involves a skin procedure or skin defect closure, you may definitely have to code that. So if it's closing a surgical site other than skin defects or wounds or lesions, you do not code it or highlight it. Also, you don't highlight bleed control, hemostasis, because that's pretty customary and it's bundled into the procedure code. You don't highlight drains, irrigation of the surgical site. Nope. And you don't highlight installation and removal of clamps and trocars because these are used to open up or maintain the surgical or operative site so the physician can view what they're doing, particularly if it's an open procedure. Also, you don't highlight dressings. And finally, you do not highlight surgical risks. Now that we've gotten that out of the way, I think you're ready to get started, and I'm going to hand it over to Mr. Sandeep. All right, Mr. Sandeep, take it away.
Next, we are having a pathology and laboratory section. We have said goodbye to the radiology section. And for this scenario, we are having Miss Melissa. I think Miss Melissa is not here with us. So Miss Eva, can you read the scenario for me?
Okay, Mr. Sandeep.
Miss Eva, can
Coders,
you
you
take the
got it.
screen for this scenario so I can do some work in the backside? I have to do some
Sure
patchwork.
thing.
Yeah,
I'll take it from you right now. Actually, hold on, because I was not ready.
sure,
Just give
sure.
me
No
one sec,
worries. No
coders.
worries.
Okay, I'm gonna take it from you, Mr. Sandeep.
Thank you, Miss Eva.
You're welcome. Okay, coders. So for the next oh, hold on one sec. Is it this one, Mr. Sandeep?
Miss Eva, that's the scenario.
Okay. Sorry, coders. What are the CPT and ICD-10-CM coders reported? A. 88104 E 1022 N 18.6 Z 99.2. B. 88108 E 10.22 N 18.6 Z 99.2. C. 88125 E 10.22 N 18.6 Z 99.2. And D. 88106 E 10.22 and 18.6 Z 99.2. Requested by R. Simon, MD. Cytology report. Collected 126 present year. Received 127 present year. Pathologist performing the service is an employee of the lab. Specimen source, a peritoneal fluid. Specimen description, 100 milliliters of yellow fluid. Cytopreparation, 2 ccf. Pertinent clinical data and clinical diagnosis. 26-year-old female with end-stage renal disease due to type 1 diabetes presents for elective kidney transplant. Cytologic impression. Peritoneal dialysis drain fluid. No cytologically malignant cells are identified. Comment. 100 milliliters yellow fluid is received from which 2 Papa Nicolau stain cytocentrifuge slides are made. Slides contain mesothelial cells with a spectrum of reactive changes and histocytes. No malignant cells are identified. What are the CPT and ICD-10-CM codes reported? Coders, you have 2 minutes.
Okay, coders, and that is the time. And how are you feeling about coding the pathology and laboratory scenarios? What do you think? How it is? How it's going? Not great is one of the responses I got. I know these are a bit of dry chapter, but as we do the churning, that will help us to save the time. So let's solve the scenario. The cytology is a procedure which is performed, and it is received by pathologist is one who's performed, and he is an employee of the lab, and the specimen is collected from the peritoneal fluid. Patient is having end-stage renal disease, ESRD, and that is due to type 1 diabetes mellitus. And the two papinic I'm sorry, I don't know how Miss Eva read it with such fluency. Papinicolo stained centrifuge slides were made. So centrifugation was the technique which was used. I'm not going to read that again. Okay, the correct answer will be option B. Let's see how we arrived into option B. These are the procedures performed. Procedure inventory, we are having cytopathology on the peritoneal fluid, and the technique which is used was centrifugation. And the diagnosis inventory, we are having end-stage renal disease, which is due to type 1 diabetes mellitus. The procedure performed was a cytopathology study. It is a study of cellular changes in disease states that happens in the disease, such as cancer, infection, or inflammation. So that was a study which was performed in the scenario. Let's look into option C, 88125, which is coding for cytopathology forensic example sperm. So 88125, what the lab analyst it performs is that it is done for any specific specimen for the forensic analysis purpose, such as any crime scenes or any something that is related to forensic. So it was not in our scenario. We had a cytopathology of a peritoneal fluid which was performed. That's why option C is a wrong one. Yes, centrifugation means a concentration. Option C is wrong. Let's look into option A. That will be 88104, which is coding for cytopathology fluids, which is performed by a washing, which is taken by a washing or brushing technique. We didn't had any washing or brushing performed in the scenario. 88104, but the analyst prepares a smear of the cytopathology fluids, washing or brushing. As I said, there was no washing brushing performed. And let's look into the next one, 88106, which is coding for cytopathology of the fluids, washing and brushing. I'm sorry, cytopathology of the fluids. This is done by a simple filtration method with interpretation. Again, no simple filtration. Our technique was a centrifugation technique which is performed. So that's why option D is also wrong. And option B is one that exactly matches our procedure inventory, which would be cytopathology, the concentration technique, smear, and interpretation. How do you feel, coders, about that one? This was a pretty straightforward one. That is very good to hear that we are having a lot of aha moments. And that was the purpose of the grip study sessions. This was pretty straightforward. Let's move on to the next one. And thank you, Miss Eva, once more reading of that difficult term and that scenario for me. So next scenario, I would like to invite Miss Jolly. Miss Jolly, all is yours.
All right, coders, what are the CPT and ICD-10-CM codes reported? A, 85049, 85041, 85018, 85004, 85014, 85025, 80047. Answer B, 80047, 85025, Z00.00. Answer C, 80053, 85025, Z00.00. Answer D, 80048, 85027, Z00.00. Clinical indications. The patient is a 28-year-old female for routine lab tests, part of her yearly physical exam. Collected 0414XX1329. Site, right antecubital venipuncture. Patient number XXXXXX. ID verified. Disposition, outpatient, fasting. Tests, metabolic and CBC. Results, sodium blood 141 milliequivalents per liter, 135 to 145. Potassium blood 4.00 milliequivalents per liter, 3.3 to 4.8. Chloride blood 105 milliequivalents per liter, 95 to 105. Carbon dioxide blood 24 millimoles per liter, 23 to 30. Urea nitrogen blood 12 milligrams per deciliter, 5 to 25. Creatinine blood 0.86 milligrams per deciliter, 0.70 to 1.50. Glucose blood 93 milligrams per deciliter, 70 to 110. Calcium blood total 9.3 milligrams per deciliter, 8.5 to 10.5. CBC automated. WBC 6.9, THOU-UL 3.9 to 10.3. Hemoglobin blood 14.5 grams per deciliter, 11.8 to 16.0. Platelet count 235 THOU-UL 135 to 370. Red blood cells 5.02 MIL-UL 4.00 5 to 5.50. Impression normal labs HCT 40%, 38 to 46%. All right, 2.5 minutes, coders, and your time starts now.
Okay, so I thought to give around 30 extra seconds for this scenario, and that is 3 minutes. And okay, let's solve the scenario coders. Thank you, Miss Jolie. Thank you, Miss Jolie, for reading this scenario for me and for us. So the key words is the patient has came for an yearly physical exam, and in the test, what she has performed is a metabolic panel test along with a CBC. So these are the tests which is performed under that. We're having a sodium blood, we're having a potassium blood, chloride blood, carbon dioxide blood, urea nitrogen blood, creatinine blood, glucose blood, calcium blood total, CBC automated, WBC, hemoglobin blood, platelet count, RBC. These are the tests performed along with an hemocrate in the bottom, and the impression was normal labs. And the correct answer for this scenario will be option D. Let's see how we arrived into option D. So the procedure inventory, we are having CBC and metabolic panel performed, and the diagnosis will be yearly physical exam. And these are our code options. So coders, what are we coding here for? We are coding for a CBC automated as well as a metabolic panel. So as you can see, there are three codes for metabolic panel. One is for metabolic panel calcium ionized, metabolic panel calcium total, and a comprehensive metabolic panel as well. So the key will be in this solving the scenario would be the metabolic panel, how to code the metabolic panel. Okay, let's first look into option A. It is coding for 85049, that will be platelet automated. 85041, which would be RBC. 85018, that will be hemoglobin, and 85014, that will be hemocrate, and 85004, that will be um, WBC count, along with 8500025, that will be coding for a CBC. So Codus, just looking into this scenario, do you think option A is going to be the correct one? Just quickly looking into the scenario to this option A. Why do you think this is the wrong answer? Why do you think option A is the wrong one? Too many codes. Yes, I will say this is coding. All these tests are coding along with 85025, which is a CBC, and there is also 85047. Okay, 85025 is coding for a CBC, which already has an hemoglobin in it. Where is my pointer? Okay, it's having hemoglobin already included, hemocrat, RBC, WBC, platelet count, and automated WBC differential count as well. Well, this was not performed. All the remaining codes are already included in CBC. And they are also saying over here, do not code 85041 in conjunction with 85025 and 85027. So will we code something which is already included in the panel or included in a particular test? No, we are not supposed to code them. That's why option A is wrong. Now let's look into the next one, 85003, which is coding for a comprehensive metabolic panel. And this comprehensive metabolic, if you have a closer look into this, these comprehensive metabolic panels has certain tests which was also not performed. You can look over here, the albumin, the bilirubin total, phosphatase alkaline, SGPT, SGOT. This test was not performed in our scenario. You see that, coders? So will we code something which is not performed? Are we supposed to code something which is not performed? No. Yeah, that would be fraud. So we won't be coding option C as well. Now let's look into the next two options, option B and option D. 80047, 80048. 80048 option D will be the correct answer. So I will say why. As I said, the key for this scenario is it will be the metabolic panel. And what kind of metabolic panel are we coding here, coder? The difference between 80047 and 80048 is just one. 80047 is coding for a calcium ionized and 80048 is coding for calcium total. So which type of calcium was done in our scenario? Was that an ionized or was that a total? Overwhelmingly, all of them are saying the correct one, and the one which is performed in our scenario over here in the green highlighted portion, calcium blood total, was performed. So that is going to help us eliminate option B, and option D will be the correct answer, that is coding for basic metabolic panel calcium total and 85027. Why did I select that? 85025 is also coding for a automated differential WBC count, while 85027 is not coding for automated differential WBC count. We are not having automated differential WBC in any of the lab results. We had a WBC, but we didn't had automated differential WBC count. So option D will be the correct one, 80048 and 85027. How was that scenario, coders? You have done phenomenal work. I can see that from the response in the chat. Good, good, good.
Thank you, Mr. Sandeep, for those AMCI amazing and awesome explanations. Miss Eva, for being the orchestrator and conductor of the best interns on the planet. Yes, I said it. Miss Melissa, Anubama, Courtney, Carla, let's get it, let's code, Dolly, and Miss Vivian. And let's not forget our interns in the chat, led by Miss Biji. And you, the students, you all are simply the best, and we appreciate you. And we will see you next time for more great scenarios. You don't want to miss it. And thank you for participating in the AMCI Medical Coding course. Until next time.